Our session today for the South to South Learning Network, where we are going to brainstorm, about the issues that relate to HIV prevention. And I believe that as leaders, we will be sharing, our knowledge, what we have on the other side and what we have on the, on this side, this south part of the world in South Africa. And so that we will be able to come up with good strategies that will help our countries. Next slide. So I'm just going to indicate to you that, as you can see here in our agenda, we've got the opening and the welcome, which is currently done by me. And we've got the presentation that will be done by Kerry Mangold, from Genesis. And we're going to have the breakout sessions, which will be in parallel. We will have breakout session A, which will look at identifying the future of HIV prevention. And we are also going to have breakout B, which will be looking at the contingency planning for HIV prevention. And we're going to have, an open discussion that will be facilitated by Tato. And from my side, I'll do the closing remarks. So, in a nutshell, looking at this agenda, I want to again highlight, and welcome you and say to all the champions, let's brainstorm together. And we are truly delighted to have you with us this wonderful afternoon. And we want to ask you if you can please introduce yourself in the chat, by sharing your name, and you share your country that you come from and the organization that you are currently working for, so that we can work together and know you and also network with you in future. So welcome to this wonderful meeting. Next slide. So the aim and objectives of this wonderful meeting of this brainstorming session, we are going to look at harnessing or sharing all our collective minds together around the issues that relates to HIV prevention, as the leads in our different countries and where we come from. And also to direct the attention to HIV prevention programming and its relevance in a broader, HIV response and programming. That although in the current context or in the current situation where we find ourselves in, we really still need to start prioritizing and also not lose momentum because of the funding that looks like it's shrinking, but to stay on course and also look at other areas. So looking at our aim, and also the objectives, our main aim is to create a shared vision and reimagine HIV prevention and revitalize the momentum around HIV prevention, as I've highlighted in the context, looking at the current context, especially in an environment where we've got funds that are shrinking. Our main objectives, we are going to co-create, a shared vision of reimagining HIV prevention that is relevant and that is adaptable to our different realities, looking at the issues that what happens in South Africa might not be the same thing as what is happening in Kenya and what is happening in Uganda. So we want to come up with a vision that addresses our individual situations depending on our country environment. And we also want to identify, the common priorities that can guide us and that where we can share knowledge with each other and where we can further say that, these are the areas of investment and prevention programs, while, meeting specific needs for each country. The third one, we want also to strengthen the local ownership of prevention, and that our prevention strategies, they are the one that will that will be sustainable and that will be able to fund, them by ourselves with the local, investment, also involving national stakeholders across all our regions, even if it comes to getting, our global commitment and political commitment in the work that we will be doing. Next slide. So in our next slide, I'm going to hand over to Kerry, who will do the presentation. Thank you very much.
Thank you so much, Kensani. Yeah, good afternoon, colleagues. It's really my pleasure and my privilege to be on this virtual call with you today. Many of our kind of friends and comrades and champions from the SSLN. It's really nice to come together. I know it's been a bit of a crazy time in the last while, and we're all still here, kind of pushing towards our prevention vision. So. I'm not going to take too much time because I think really what we want to do is use this workshop to engage, as Dr. K was just telling us. But what I do want to do is just remind us all of where we've come from, what the SSLN has to offer countries as you rethink HIV prevention, and share with you where we are at as a program, and where we are going over the next few months, because I think this is a journey that we are all traversing together, and it would be good just to all be on the same page. Of course, you're always welcome to engage our country engagement leads or anyone on the SSLN team if you have any questions. But yeah, I will do my best to give a short overview over the next 20 minutes. So just to start at the very beginning and remind ourselves that the SSLN has 5 aims or 5 objectives that we are seeking to achieve together with you all as HIV champions of the SSLN. Overall, we exist to support you in strengthening your HIV prevention programs by working with you and unlocking spaces and activating and catalyzing the work that you do on HIV prevention and trying to support solutioning across the region. And how we do this, firstly, is by supporting you all to assess and identify programmatic gaps and priorities. I don't need to remind you about all the very many PSATs that you've done over the years. Secondly, we want to support you to document and share and replicate promising practices in HIV prevention. And you know that we do this through many different forums, link and learns or webinars, case studies and virtual tours. We also want to build social capital amongst program managers across the region, and provide safe spaces for problem solving. And we've done this through workshops or country visits, and now it happens organically. And I think we're so happy that there is this kind of army of HIV prevention leaders in Africa who know one another, who meet one another and really lobby for an African led solution to HIV prevention. We also want to support countries in strengthening policy and strategy development, whether that's an NSP or a new guideline for medicated or medicine-assisted therapy for people who inject drugs, or a new strategy for adolescent girls and young women. But we also want to support countries as they write their prevention grants. Historically, we used to say this was COP and the Global Fund. But obviously, we all know where we are at the moment. And I think in future, this is more likely to be the Global Fund or other potential funders, whether that's domestic or international. And lastly, we really want to support optimized implementation for impact. And I think we have a few case studies in countries where you have shown, how you've taken learnings and applied them into action. So that's just a reminder of what we seek to achieve as the SSLN. If we go to the next slide. So this again is a little bit reminiscing, but just to remind you all, the SSLN was born in response to a request from African leaders. So there used to be the NAC Directors Forum. It's now called the Multi-Sector Leadership Forum that exists. And it was this forum and through your CEOs and DGs who asked UNAIDS to initiate and establish a South-to-South learning platform. And this was back in 2019. And because of this ask from African leaders, the SSLN was born. And it started as a pilot, and we've now moved through a number of phases over the last 5 years, which is summarized on this slide. So some of you may have been with us all the way from 2020. We started during COVID. And yeah, over the next 5 years, what we've done is we've expanded to include 15 countries, which you can see on the map there. We've expanded and now include all pillars of HIV prevention according to the GPC framework. We operate across Anglophone and Lusophone and Francophone countries. And more recently, we added an evidence to action arm to the SSLN. And some of you might know this as Eye to Eye, and you might recognize Toby, who's our AI kind of chatbot and ambassador, if you will, for Eye to Eye. Importantly, and I hope you can all testify to this, you know, the SSLN really wants to be country-led and consultative in the way that we operate. And so over time, we've built up a network of prevention leaders from government and civil society and development partners and communities. And what we try to do is to facilitate an assessment and then support countries in responding to what they identify, whether it's supporting them to share their best practice or supporting you to fill gaps or gain learnings on areas where you need strengthening. So we can move on to the next slide, please. And I hope that a lot of you on this call have participated in many learning activities. The SSLN have curated and implemented almost 300 learning activities over our lifespan. And these come in all shapes and sizes. And there's a picture here and the numbers next to it, but just to say, you know, we facilitate learning activities at all levels. So like I said, it could be what we call a community of practice, like we do the Key Populations Community of Practice, and we actually have one coming up on the 3rd of July with the Global Prevention Coalition, or it might be country learning visits or workshops where we get to spend time with one another. But just to say, we think it's really important to share learnings in more than one platform and to continuously engage with our champions as we kind of build learning over time and share experiences. Next slide. So it's all good and well that we, that we have this wonderful network and that we curate all of these really exciting learning activities. But this is just a reminder to say, you know, there is a logic to this and there's a theory that underpins what the South-to-South Learning Network does. And so we do have what we call a theory of change, which helps to guide where we put our focus and where we see impact likely to take place. So if you just follow from left to right, we started by establishing the learning network. We then supported consistent participation and utilization of the resources. And we think that this has led, or we have evidence, which I'll show shortly, that this has led to individual improved capacity and knowledge and capabilities for HIV prevention. And ultimately, that then leads to organizational and national level change, which we believe will lead to reduced incidence and impact and ultimately achieving sustained epidemic control. Next slide. So maybe I should start by saying thank you very much to everybody who participated in some of the evaluation of the South-to-South Learning Network, because I'm sure you all know that we too are looking for sustained funding to support you. And what we need to do that is to have evidence that the SSLN as a platform is something that countries find valuable and something that ultimately is leading to change in the HIV prevention sphere. And so the Gates Foundation contracted an organization, an external organization, to do an evaluation of the SSLN. And they've done this now twice, at a midpoint and again last year. So we had really good participation. And like I say, I want to thank you because I think it really is meaningful to be able to evaluate the SSLN. But what we were able to see in this evaluation, and you can find it on the website if you want to read the whole report. But basically, if you just look at the bottom blue block, what I'm going to say is, 90% of the champions, 90% of SSLN champions reported that they have improved technical expertise and knowledge on HIV prevention. 86% of champions noted that the network has given them practical tools and resources, and 86% of champions reported that their participation has given them insights that's improved prevention in their countries. And I think this is really powerful, and this really kind of humbles me in some ways, because I think, for me, it's really showing that experiential learning and peer learning really is critical for the work that we do. And I think that's even more important now when external resources are decreasing. We have one another and we have the social capital in this network to harness and improve programs. So I think this was really, really powerful to show that by facilitating this learning, we're able to support improved programming on the ground. If you go to the next slide. I think something equally important to improving knowledge and improving programming, though, is also creating a safe environment and creating a space where honest kind of conversations can happen, whether that's within a country or across countries. And so another finding that I wanted to share with you, because I think it really is who we are as SSLN, is that Champions really believe that partnerships, networks, relationships have strengthened, and that this provides a safe kind of country-led dialogue where difficult discussions can be had in a frank manner without an external agenda influencing what's happening. And so I think it was a really good finding, and I think something also that we are really proud of as the SSLN in terms of facilitating this, and this being a key finding of the external evaluations. Next slide. So back to our objectives. We sought to do many things as the SSLN, and I think what I can share with you is that what we've learned and how we've adapted along the way has really helped us to achieve our objectives. And this slide, I won't spend a lot of time, but there's just some really nice quotes showing that, what we sought to achieve, we have. And there are some real kind of lived experiences in countries and real examples where these are quite obvious. So we'll share these slides so you can read through it in detail, but I think I will just move on for now. Because why I want to move on is that obviously the SSLN has existed through a period where there has been, although sustainability and transition and integration have been top of mind, I don't think any of us expected the decline in funding over the last few months. I'm not sure any of us, expected our models for HIV prevention to change so drastically as we're working towards the 2030 agenda. And on a positive note, I'm not sure all of us fully appreciated the now huge range or package of HIV prevention options that have become available to us. And so I think we're at a really critical point, actually, in our HIV prevention journey in a region, that it was really timely for the SSLN champions to convene. So I'm going to speak to each of these points just in a little more detail, because I think it's a really critical moment for prevention and for this discussion that we are having today. So if we can go to the first kind of slide on our changing dynamic, please. So some of you might have seen this graph on the slide that I'm showing you, at least the blue line. And the blue line is basically what has happened in terms of declining HIV infections since 2010. And the green line is the 2030 target that we had, which basically said we will reduce new infections by 90% from a baseline of 2010. So that's a graph I'm sure all of us are super familiar with. But what's new on this graph is the red line, which says that due to some of the funding cuts, we are now some kind of global modeling, and this is a UNAIDS, from a UNAIDS source, we are projecting this huge spike in new infections taking place due to the funding cuts and the programs that have been affected, and kind of the halt in HIV prevention in many of the countries. And I think this is, I don't think it's meant to alarm us, but I hope that it has, and I'm sure. I mean, we sit in many of the country spaces ourselves, and we know that this is really catalyzing discussion in countries. So that's the first thing that's on our mind. The next thing that's on our mind, on the next slide, is that it's super exciting that we have so many new prevention options available to us. I know this slide speaks to ARV-based prevention, and we know that Caballet and lenacapavir are very much on our horizon. But I think even beyond biomedical HIV prevention, there are just so many innovations and there's so much evidence now that the choice agenda is something that we have been kind of pushing for over such a long time. What's important, though, is that sometimes there's still low uptake, low demand, and now I think we're going to be struggling with who's going to fund some of these programs. So I think that's another thing that's kind of acutely on our minds as HIV prevention programmers. The third thing that's on our mind, and I have already alluded to this, but we know there's a significant reduction in donor funding, and we know that it's affected many different components of HIV prevention in country, from kind of the workforce to commodities and supply chain considerations to service delivery and surveillance. And I think importantly, it's not just programs affected, but systems are affected. And some of the populations that are kind of most at risk and marginalized are now being further pushed away, and programs are not are no longer meeting the needs of the people who need them. And then the last consideration on the last slide is just that we're also in a space and a time now where UNAIDS are developing a new global AIDS strategy. There will be a new global political declaration. There will be a new HIV prevention framework coming out. And we think it's really important, as the SSLN is part of the Global Prevention Coalition, we really want to support UNAIDS and the GPC through their consultation processes and make sure that we are very aligned, that the global AIDS strategy and framework are being influenced by the SSLN and by what we are gathering as insights from our country champions, which is again back to the purpose of today. So if you go to the next slide. So having said all of this, the SSLN has now entered into a new phase. So we closed out in some ways as you knew us in about April this year. And we've entered into just a short transition period where we are rethinking, what does the future of HIV prevention look like? And I'm sure that's something on everybody's mind. But also, what can the future of the SSLN look like to support what HIV prevention is going to be in the future? And I think we always want to be quite reflective and make sure that we meet the country at your point of need, and kind of meet the moment of what the prevention landscape looks like. And so that's a secondary consideration that we have at the moment. And from now until the end of November, we want to be engaging you as champions as we redefine and reconsider and recreate what we think the future of prevention looks like and what the future of an SSLN might look like to support you. And we're doing this through two mechanisms. The one is country-based, and that's using various methods engaging with you as champions. And so that looks very familiar to you. I'm sure some of you, Uganda and Kenya, we've just had our champions meetings with you, other countries, they're coming. But we've also set up a structure that we're calling the Expert Ideation Hub, which is a global ideation space where we've brought in some stalwarts and some thought leaders and some experts, not just from the field of HIV prevention, but from the field of SRH and digital health and vaccines and private sector, etc. And what we're hoping is also to give space to ideate new ideas around HIV prevention. We do have Lakmo, and I think you're on the call with us today. Lakmo from Zimbabwe, from the youth sector, is also represented in that structure. Dr. Beatrice from the Malawi NAC is also on that structure. And so I think we have some country voices, but we also have some kind of new faces and new voices. And we're hoping that there will be some feedback loops between the countries and between this hub, where we'll also be having similar discussions. And at the end of these few months, when we get to November, when our current grant ends, we're hoping that we'll have some consolidated write-up of what reimagined prevention looks like, and that in some ways we will have helped to facilitate discussions that are already happening in your countries around HIV prevention at the same time. I think that was my last slide. Can we check? Oh, no. Okay, one more. So this one is really the segue into today. So we thought it would be really useful to bring the champions together. Number one, just to tell you where we're at as the SSLN and reflect on how we got to this point, but importantly, to also help move the discussion forward and gather insights from country champions on the future of the HIV prevention narrative and in terms of how we can support you with your country planning for prevention, given this new space that we find ourselves in. So I think I'm gonna leave it here for now. The purpose, as I say, wasn't of this meeting is not for many presentations. So you're welcome to put any questions you have in the chat or reach out to me directly or any of your country engagement leads. But I think what I'll do is hand back to the chair, because what we're really hoping to do is use our time together to hear from you rather than the other way around. So Kensani, I'm going to hand back to you now to take us forward. Thank you.
Okay. Thank you very much, Kerry, for such a wonderful presentation. And, it was very informative. We will be able to take, some of its contents and sort of use it to start the discussions in the different groups. I'm going to hand over to Mo now, who will facilitate the breakout sessions. Over to you, Mo.
Thank you, Nkosana, and thank you, Kerry, for all that scene setting. As emphasized, this is a champion brainstorm, so we really want to hear the champions' voices come out loud and strong. So on the next slide, I'll show you what we have planned for all the colleagues here. Essentially, we're going to be running two thematic areas. They'll be run in parallel. The first is on ideating the future of HIV prevention, and the other is on HIV prevention contingency planning. So those are the two topics we find very informative and very important for us to explore as we move into this new space. So for about 60 minutes, we're going to open out breakout rooms. And in that room, you'll have a facilitator who has a deck with structured questions, and you'll be able to talk together and work through those questions. From there, the facilitator will capture the conversation on the template provided. And hopefully, if you're able to complete it within the 60 minutes, then just the facilitators will let us know, and maybe we'll close the breakout rooms a bit earlier. When we all return back into plenary, I think that'll be a great opportunity for a few teams to share their discussion and some highlights. And there we will have facilitated discussion thereafter, where we can all have all talk to the key points that have been highlighted. So in a second, you'll find the prompt come up for the breakout rooms, and you can choose to join into one of them, or you'd be randomly assigned just after a moment. There are Portuguese and French rooms available as well on the topics, so those will also become available in a second. Just going to check. Tony, have you opened up the breakout rooms?
Yes, the breakout rooms are open. Champions can choose which room they want to go to. If it has not popped up on your screen, just look at the bottom of your screen. You should see the word breakout rooms. If it does not appear, please click on more, and then you should see breakout room, and then you can choose the breakout room. Those that are struggling, we will also assist.
Hasina's hand is up.
Yes, I think it would be very useful if you could just flash what are the key questions for each of the breakout sessions so that we can select accordingly. It's going to be very difficult for us to select and we may just end up going to the wrong breakup room. So if you could just, before we break into rooms, just show us what the questions are and so that we can choose appropriately. Thank you.
Sure, not a problem at all. So I'm just going to flash up quickly on ideating what that might involve. And then I'll also show you what the contingency plans might look like. So in ideating, it's basically the conversation of evidence-based planning, equity and innovation, sustainability and impact. And you're in a scenario where you need to think about adoption of new prevention technologies, differentiated service delivery, community-led approaches for prevention, leveraging digital innovations and sustainable financing for prevention. That's on the ideating component. And then on the next one, which is on contingency planning, that is primarily talking about developing contingency plans and what that involves, sustainable financing, prioritization for impact, high impact interventions, and addressing bottlenecks.
Thank you, everyone, and welcome back. So what we will do now is just hear back from different groups. And I understand we had quite a number of groups, but in the interest of time, we will call on a few to just share with us, and then we can have discussion. We'll start with the first group, group one.
So thanks, everyone. So for our group, we had an opportunity of engaging in a wonderful discussion. And in our group, we looked at two questions. And the first question was just helping us really unpack what the opportunities are, what the challenges are, as well as the recommendations in terms of, adoption of new HIV prevention technologies, paying attention to equity and impact. So from the team members that were contributing from my team, we saw like there are quite a number of opportunities. And number one is availability of guidelines and national strategic plans across countries. And we saw South Africa share that, this is already an opportunity that, other countries should really think about in terms of, setting the ground for the adoption and scale up of, new technologies. And also we've heard of, new technologies such as, injectable PrEP that, can be done like twice, in an interface of like twice. So this is an opportunity because, across the different populations that we work with, there's already a pill burden. And I think if there is an injectable option, then of course this gives people an opportunity to really adhere to, their prevention methodologies and approaches. Then we also saw an opportunity from Kenya, where the country or the government has adopted what we call the social health insurance scheme, which of course provides an opportunity for affordable and accessible healthcare. And right now, the conversation has been around, integration. It has been around how do we ensure that we don't leave anyone behind. So also that stood out as an opportunity. And also advocacy for prioritization and investment stands out to be a critical opportunity that, stakeholders and countries really need to pay attention to so that we can lay a ground, for the adoption and scale up of these technologies. Also, there was an element that was brought into the conversation in terms of how do we leverage on pooled or regional procurement of these new technologies, because we understand they're not cheap as we think. And just having like a more collaborated approach to the procurement is an opportunity that countries can really think around and ensure that no one is left behind. Then how do we expand? The other opportunity here is around expanding HIV prevention, services beyond the current model, because with all these new technologies that are coming in, that it's already an opportunity. It's a plus to what we are already offering to the different populations that we are working with. Then also we heard from Ghana, they are currently developing their, HIV prevention roadmap. Also, this is an opportunity just to ensure that, the new prevention technologies are well articulated, and there is a framework already, there is a framework that already exists that gives an opportunity to ensure that the introduction and scale up of these technologies, is well anchored within that context. But also the other opportunity that was highlighted is around, disability mainstreaming, because we are working with different groups with different needs, but also we need to pay close attention to disability and what that means in terms of all these prevention technologies. We need to ensure that there are spaces and platforms that allows people with different forms of disabilities to articulate their issues, and also ensure that these technologies are also customized to better address their needs. But we cannot forget that we are in an era where, social media, artificial intelligence is really, the talk of town. So how can we also continue to leverage these spaces, especially to, create awareness and even influence, how people perceive or even the uptake of these new technologies, and ensuring also young people are not left behind. Then the cross-cutting challenges that were highlighted in terms of the adoption, of course, is around, we have the plans in many of our countries, but how are we cascading them, or are we even progressing to the implementation? So there is need for us to really start thinking from how do we move from the documents that we've built, that we've developed, to the actual implementation. Then there's need for, us to think around, there is phobia. People have phobia when it comes to, some of these technologies that include an element of injection. So how do we start addressing some of these, potential challenges, but that might even impact on uptake? Then we've also seen issues of, shrinking funding landscape. We've seen the withdrawal of funding, in the most recent. So already this is a challenge that countries are, experiencing, but we need to start thinking around opportunities for domestic financing, opportunities for engaging the private sector, just to ensure that we are better placed and prepared, to roll out and scale up some of these interventions. Then the other one was around, acceptability, preference. How can these play out when it comes to, rolling out these technologies? So that's food for thought for the team. But also, as we are thinking around these new prevention technologies, how do we ensure that we don't overlook the approaches that have already worked? We've seen condoms that have been with us for the longest time. And if you're going to introduce new technologies, does this mean, people will stop using condoms? Are we going to see an upsurge in STIs? So those are some of the issues that the team put forward. But the recommendations that we are seeing here is that there is need for the ministries of health, the departments of health, to start piloting, cascading, and even championing some of these interventions, in spaces where they are needed. Also, there is need to develop and launch, training plans for healthcare providers, so that they are really equipped and ready to, to support the different populations across this journey. And just like I've mentioned, we don't need to overlook, other, prevention approaches that have worked before, for instance, condoms, and of course, not forgetting the intensity of advocacy that is needed in this particular space. And lastly is around, do we have our strategic plans in place? And are they, providing us an opportunity to think around the implementation and scale up of some of these interventions? Then progressing to the second question around differentiated service delivery, the team here saw the opportunity of engaging the private sector players, from clinics and pharmacies, in just ensuring that, these services are accessible to the different populations that need them. Then again, how do we decentralize these services, and how do you ensure that they are integrated even within the youth-friendly facilities and even other private sector facilities? So our whole element around integration was really critical to our conversation, and ensuring that as we integrate these services, we also pay attention to, mentoring service providers, and ensuring that we address stigma and discrimination, which is still a huge barrier to access and uptake of services. And also not forgetting the digital technologies that are with us. We've seen young people, especially the KPs in Ghana, who are now being reached through virtual platforms. So this is an opportunity for countries to really harness and ensure that we can reach young people, key populations in their spaces with information as well as services. But also another opportunity is the element around discordant couples, especially at the antenatal, clinic, or even the SRH services. We also need to tap into those spaces so that we can ensure that, these services can adequately and equitably reach the different populations that we work with. Then we also had, cases where, viral, hepatitis, vaccination has been introduced at birth. And these are some of the, low-hanging fruits that countries also need to look at when you're talking about, differentiated service delivery. How do we integrate PEP, how do we integrate PrEP even at the ANC package? So there was a lot of, discussion and sharing from across countries in terms of how we can, integrate and ensure that, we don't leave anyone behind. But of course, all this came with, challenges that we need to pay attention to. We cannot talk about, differentiated service delivery models without, the element of pharmaceutical pricing, because some of these commodities, they are not cheap. And, just ensuring that we monitor the private sector, we monitor their reporting of HIV prevention commodities. This is a challenge that countries have already recognized, but also it's an opportunity that we can leverage on and see how do we work with these players in ensuring that the pricing for some of these pharmaceutical products is, is something that is clear, well understood, and countries are ready to move forward. Then also timelines that it takes to register and roll out, some of these, new prevention products. It really takes quite long. And we had examples from, countries like South Africa, trying to give an example of, PrEP injectables. So it, like the times really vary across countries, and at times it can be lengthy. And these are products that are needed, by the different populations. Then the other one was around data confidentiality and privacy, especially with digital technologies. How do you ensure that as we use these technologies, we are also cognizant in terms of, confidentiality and privacy of the users on our platform? And again, procurement of, vaccines also was highlighted as a major challenge that countries are, experiencing because of also the high cost of some of these, products. But also not forgetting the level of awareness for commodities like PrEP is still low, in some of our countries, such as South Sudan, and also the stigma levels are still high. So also this is a challenge that might also impact how people, access and even, take up some of these services. But also key to, the key populations, we had, examples being shared across, the East Africa region. How is government engaging diverse stakeholders, or how is government engaging the key populations in terms of the transition, in terms of the integration, as well as sustainability in all these aspects around, service delivery for these populations. And some of the recommendations that were put forward is there is greater need for us to rethink how we engage the private sector right from inception to rollout of some of these, innovations. Then also allocation of resources across, the different elements of the healthcare system. But also what was highlighted is there also need for us to build capacity for the private sector players to really understand even the data systems that are being used, because data is critical for decision making. And if we just go ahead without really engaging them and building their capacity, then we could be missing out on what could even get us to the next level. Then, of course, there's need to have integrated guidelines that can make it easier for, PrEP to be rolled out even within the ANC, service delivery models. And lastly, this was just a question that was posed to everyone in the room. How best do KP-led organizations self-sustain their drop-in centers, recognizing that many of them have been supported through different mechanisms, but right now the support may no longer be there, but there is need for us to keep on sustaining service delivery. So it's food for thought, but it's an opportunity for us also to think and innovate. So thank you so much. This is what our team shared. Back to you, Chair.
Thank you very much, Lamek, for capturing the Group 4 discussions. We'll now move to Group 1. We'll now move to Group 4, and Madonna will take us through Group 4 discussions. Madonna, over to you.
Thank you, Tato. Group 4, we looked at the adoption of new HIV prevention technology and the opportunities and challenges that are related to that. Just a minute, let me quickly share. Okay, so looking at the adoption, the opportunities are that there exists already a sort of a cohesive structure within the government and non-governmental agencies in Côte d'Ivoire, which could in a way, influence the adoption of those prevention technologies. Another one is that the participants seem to think that this would increase the voluntary adherence of persons living with HIV, since the cycle of injection is fewer and they can also come to the hospital lesser than they used to. We also have feedback that data and research has shown their efficacy, and that is quite encouraging and would also encourage people to use them. This would lead to improvement in adherence, and someone from Congo also shared that there exists a data platform which could be improved with this new prevention technology. Now, the challenge that cut across the both countries that was shared was the cost. Everyone kept saying the cost is expensive, and there was a concern about the approval from WHO. For instance, the discussion about if the FDA has approved, what is the standard of WHO, and the fact that many African countries use products that are only approved by WHO. Another one also is lack of information circulation, when not a lot of information is in public about the products and how people are actually accessing this information. Our recommendations were generally around advocacy. That's advocacy to the public, advocacy at high level, advocacy that has to do with key community stakeholders, populations that are important, and policies that should be put in place, like a specific budget for those who are at risk for buying these at government levels. And when we looked at sustainable financing for HIV prevention in the countries, opportunities that were shared from Côte d'Ivoire included a group that already exists. So a sustainable financing group already exists in Côte d'Ivoire that meets. And another thing again is in Côte d'Ivoire, there is a roadmap currently in progress for sustainability development that involves all the actors, all the key stakeholders. And in existence is a national fund for HIV prevention that they have been using for a while. Now, for the challenges will be, how do we fill the gap that was caused by the USAID cut? Because USAID before now supported a lot of community programs. Another thing again is the gap, the stop of the international resources that have been affected by the USAID cut and all the funding pullout, because a lot of NGOs have been affected, a lot of resources, structures, people who otherwise before now were some sort of stakeholders that could be looked up to improve the system that are no longer there. So even if these programs, even if there are groups for sustainable financing, even if there is a roadmap that is currently in progress, how do we fill that gap that is caused by not just the money, but the human resources and the structural resources that already exist? The recommendation was around putting in place the roadmap, that is the one that is in progress, and also thinking about domestic resourcing. Thank you very much.
Thank you very much, Group 4, and I think we are seeing common themes, at least from between Group 1 and Group 4. But without a waste of time, maybe let's move on to Group 6 rather. And I've been given Missy to take us through Group 6. We will then have a bit of discussions after the next group. Thank you.
Thanks, Chair. So Group 6 looked at 3 thematic areas. In the discussions, we thought the 5 thematic areas overlapped in some ways, so we focused on these first 3. On developing contingency plans, first was the understanding that contingency planning assumes there's an issue that we need a response to, but we also looked at it as also beginning to identify any potential risks and putting mitigation measures in place. So contingency plans should address issues around integration. And this means ensuring that HIV prevention interventions are linked to other existing interventions or structures within the health system. It should address issues around prioritizing interventions or strategies based on the context, the country context, as well as its potential impact. So basically looking at the robustness of the interventions or the systems. And contingency planning should also look at addressing coordinated multisectoral involvement to ensure that plans are country-owned and country-driven. And the group felt that anytime we are doing planning, we should always have an exit strategy in mind in scenarios or aspects that are not funded through domestic funding. And linked to that on the issue of resilience, again, we said a resilient HIV prevention program is one that can withstand some of these shocks and still be able to provide services.
That's a BMW.
And provide services that are required in a manner that is required. A resilient program should be able to rapidly adjust in the face of any rapid changes within the environment and adjust in or adapt in such a way that meets the needs of the population and provide services differently within that context. So at the end of the day, then that means that when we're looking at contingency planning and for a resilient HIV prevention program, it should be able to address issues around governance and leadership, issues around supply chain mechanisms, issues around service delivery, and so forth, so that we are able to adapt quickly in the face of any crisis or challenges. Our second thematic area was on prioritization for impact. And the group defined or rather agreed that prioritization should be informed by evidence. Evidence from a data perspective, but also evidence from the perspective of what works currently or what is promising as far as innovations are concerned. But also in addition to evidence, we also said that prioritization should also be informed by our resource environments and our implementation capacity. And an example was given that, for example, if we are propping PrEP as an intervention that works, then the questions we need to be asking ourselves as countries is, can we afford it to implement it, or can we afford scale up to ensure that the populations that need that particular service are able to access it? And as far as this prioritization is concerned, the group also identified some critical factors that then need to be looked into. And one was ensuring there's a robust data or M&D system in place, that there's room for research to allow for interrogation of current practices or strategies, but also support programs identify innovations that can work. It should address issues of ensuring sustainable engagement, especially community engagement, both in resource mobilization as well as implementation, and to strike a balance between maintaining core prevention interventions and introducing innovative approaches. We say that this should be based on resources. So basically protecting, I think the general argument was we protect what works, what has been proven to work, but also create.
Missy, please wrap up. We are running out of time.
For immediate or for innovations, and always being cognizant and providing room for review to enable adaptations. And then on the last one, on sustainability, I think a lot of it was covered in the previous discussions, but identified 3 key issues: ring fencing for HIV prevention, within our different countries, identifying key private sectors and looking at modalities for getting either mandatory contributions or subsidies for government-provided services, addressing integration, which we've already talked about, and opportunities for increasing domestic resource mobilization, including strategies around community engagement. Thank you.
Thank you, and apologies because we have and we are running out of time. Thank you to Group 6 and Missy. Group 8, I've been given Daniel or Likwitse to take us through Group 8. Likwitse, or is it Daniel?
Yes, Daniel.
Oh, Daniel. And Daniel, if I may also request that you really summarize the discussion points. We will share I think they will share the presentations. We are running out of time. Thank you.
Ok, tá bom. Muito obrigado. Bom, na nossa discussão, naquilo que seriam ações muito importantes no desenvolvimento de planos no contexto de emergência, para a primeira questão, que planos de contingência devem ser implementados para garantir continuidade durante as crises. O grupo discutiu e falou-se da necessidade, primeiro, da avaliação do roteiro de prevenção, que irá facilitar a priorização das ações. Uma vez que nós temos um roteiro de prevenção que está em curso, há necessidade que, na elaboração dos planos de emergência, temos que olhar para este roteiro de intervenção. Garantir que os planos de respostas às emergências no geral, nós sabemos que temos várias situações. Moçambique é experiente em situações como esta que temos de Cabo Delgado, e as ciclones e outras coisas, e agora, por exemplo, na questão de restrições, há necessidade de que sempre que se elaborar planos de emergência para resposta às emergências, haja inclusão de intervenções de prevenção do HIV. Outra questão é que os planos, sempre que forem elaborados, olhem para os dois contextos, porque há necessidade que o país saiba elaborar o plano olhando para momentos em que há disponibilidade de fundos e situações em que há restrições. Ao fazer estas avaliações, vai-se conseguir fazer a priorização das ações, vai-se olhar para intervenções com sustentabilidade e de impacto. Necessidade de avaliar a questão de sobreposição de esforços entre os intervenientes para que não haja dispêndio de recursos, mesmo em situações de crise. E o mais importante é que estes planos sejam elaborados de maneira antecipada. A nossa situação, por exemplo, questão de calamidades, e guerras e outras situações como essa de restrição, há necessidade que o país já esteja preparado. Tem um plano rotineiro, sim, de ação de prevenção, mas precisa sempre ter na manga um plano de emergência para resposta às comunidades. No outro ponto que tem a ver com a questão de garantir a resiliência, achamos que o passo número 1 seria, na verdade, a mobilização dos fundos internos, reduzir quanto mais a dependência do financiamento externo. Isso facilitaria a resiliência dos planos. Mapeamento dos setores públicos, privados, na busca de financiamentos, e a avaliação do impacto das restrições. Também há necessidade de desenvolver estratégias que envolvam serem implementadas a responder à escassez, que envolvam as comunidades religiosas e lideranças religiosas, líderes comunitários para a disponibilização de recursos, porque é importante empoderar as comunidades para que esta comunidade saiba a relevância de fazer, de ter esta questão da prevenção. No outro ponto, que tem a ver com o financiamento sustentável, que mecanismos de financiamento sustentável para a prevenção poderiam ser feitas se, na verdade, acaba sendo uma repetição do outro ponto, porque nós, quando olhamos para a questão da resiliência, olhamos também para a questão de disponibilidade de fundos, que é a principal lacuna também para garantir estas intervenções, é a questão de mobilização de fundos internos, mapeamento, acaba sendo uma repetição, com o envolvimento das comunidades religiosas. Temos também, na questão da sustentabilidade, que é o segundo ponto, que é garantir a disponibilidade, que seja financiamento interno, já tinha falado na questão de mobilização, envolvimento do alto nível na mobilização do financiamento e nas próprias intervenções de prevenção. É importante que as mais altas autoridades do país percebam o que são essas intervenções, qual é a relevância, qual é o risco de não ter intervenções de prevenção e qual é que é o custo disso, porque se nós não tivermos prevenção, teremos mais gastos no segmento do tratamento em si. Necessidade de integração da prevenção com os outros serviços de saúde, não ser uma intervenção específica do programa da HIV ou comunitário. A necessidade de inclusão da prevenção do HIV nos pacotes de educação, ao nível do setor de educação, se estas mensagens forem passadas para as comunidades, ao nível da escola, ao nível das comunidades, é muito mais fácil conseguir garantir-se que estas comunidades estejam mais empoderadas, estejam a par e tenham mais responsabilidade na própria prevenção em si. Como diz o ditado, que é de pequeno que se torce pepino, quanto mais cedo se tiver estas intervenções, houver o pacote de educação, envolvimento de outros setores, mais facilmente teremos resultados. E também, no âmbito da sustentabilidade, voltamos para a questão de envolvimento e participação comunitária, que teria que ter necessidade de uma capacitação e apoio técnico das próprias comunidades, sociedade civil, para que tenham domínio dos aspectos de prevenção, para que possam melhor contribuir. Olhando para a definição das prioridades, nós olhamos para intervenções que estão em curso atualmente, que também achamos que seriam prioritárias como tal. Temos a necessidade de fortalecer intervenções comunitárias. Nós temos situações de educação por pares e outras que achamos que são fundamentais na questão de prevenção, porque são as que têm impacto na mudança social e de comportamento. Depois, nas intervenções biomédicas, priorizaríamos a questão da PrEP e do próprio preservativo lubrificante para grupos específicos em termos de priorização. Olhando para a PrEP, nós olharíamos para as populações-chave, para a mulher grávida e latente, migrantes, mineiros, militares, que são grupos que, na nossa realidade, têm se mostrado como grupos de alto risco. Então, a necessidade de apoiar-se, mantermos intervenções como prioritárias para que estes grupos tenham a prevenção, tenham insumos de prevenção e tenham outras intervenções importantes. Algumas questões teríamos que complementar pela questão do tempo. Não deu para terminar todas as questões, mas o que o grupo discutiu foi basicamente isso. Obrigado.
Thank you very much, Daniela, and my apologies for really pushing you and not giving enough time. I would like to thank all the groups and the presenters. Unfortunately, due to our time, we are not even going to open up for any further discussions. But if you do have any further questions for any different group or a country, post the question, and hopefully they'll be able to respond to. And at this point, I want to hand over to the chair. Thank you so much for this opportunity. Bye.
Good afternoon, colleagues, and thank you very much, for all the informative discussions that took place in your groups and the presentations that we have seen now. It really shows or indicated that indeed when you met, you did a wonderful work. So I'm just going to quickly, when we close up, just give you some of the key priorities that came up of the presentations for us to note. That as Tato has indicated, that we will not have enough time, to quickly go through the discussions. But I want to just note that, one of the key things that was highlighted, especially when it comes to the issue of adopting new technologies, we noted that the new technologies that are currently in the market, they are the injectables, especially in PrEP. Like in South Africa, that looks like it's ahead, when it comes to PrEP. That is something that we really need to, to push and ensure that it's rolled out, throughout the whole country. And we noted the issue that in Kenya, there is an introduction of the social health scheme insurance that will help a lot of people, in accessing treatment or in accessing HIV prevention services across the country. We noted the issue that while we're even doing that, looking at all these new technologies, we need not forget the issue of mainstreaming, disability services, because when we talk about not leaving anyone behind, we must also not leave those who are living with disabilities behind. And also let's take into considerations the issue of social media, that currently, especially our adolescent girls and then young women and boys, they use the social media. There are a lot of things that are done in the social media, especially on TikTok. So let's take advantage of TikTok that is used almost at a global level. And then there are also some key challenges that we are noting. We are also noting that when it comes to new technologies, we tend to run with the new technologies and forgot what is it that have worked previously. So while we're introducing these new technologies, let's also move along with the interventions that we know that we have been gaining, out of them, especially when it comes to the promotion of condoms. We know that condoms works, and however, it looks like we have lost the momentum of promoting condoms all over. So when looking at differentiation of delivery of services for HIV preventions, we need to ensure that at all times we have, a contingency plans that we have. And also, we also need to take into account that each and every country, when you are developing these plans must also align to the resources that you have, because it doesn't make sense that you've got good plans, but these plans are implementable. So we call on all the countries that at all time have a contingency plan, and also note that resources might dry out along the way. And also the issue of sustainability that is being noted, that the dry up or the move of the donor funding community and focusing on other issues, especially issues of climate change that relates to health, and leaving prevention, to be left at at something that is at the back. It's something that means that, countries need to prioritize. Countries need to come up with sustainability measures to be able to implement those programs by themselves. And also, we need to look into the issues of prioritization. That prioritization must be based on data, and it must also be based on the resources that are available, because we can't just look at something and then we just move with it without thorough knowledge of it or without thorough data to prove that it works. And again, let's take into consideration the issues, of targeting. That who are we targeting in our response? Who are we targeting? How is the environment? Are we able to reach all the communities that we know that they are at risk? And remembering that key populations are not the same in all the countries. And again, I also want to note that, when you go back, we develop those plans in all our individual countries. Let's take note that the South-to-South learning network teams, they are available to assist you. They are available to give you guidance at all times and work with you, ensuring that you've got plans that are costed and plans that are implementable. And thank you very much for attending this meeting. We will meet next time again. Please don't forget, we've got an evaluation that we need to do. You'll see on your screen that, just tap on that evaluation and assist us. If you can quickly scan the code and you do the survey that is being highlighted, we'll really appreciate. So 2 minutes, we are requesting the 2 minutes. Please tap on the survey and then we give the evaluation or we answer the questions that were asked on the survey. If you were out for some few minutes, please scan on the code, that is projected on the screen, and we do the survey. Thank you, Madonna, for sharing the survey link. For those, with the phones that can't link to the code that has been provided, Madonna on the chat, she has provided, the link that we can use. And the link is also shared on the South-to-South Learning Network Champions WhatsApp group. And while we are busy scanning, we want to thank, all the funders. We want to thank the Gates Foundation, the University of Manitoba. We want to thank Genesis and then HIV Leadership Forum and the Global HIV Prevention Coalition, for ensuring that we still continue to have these conversations around HIV prevention. We really appreciate all the efforts that you bring on board to ensure that we really eliminate HIV as a public health threat by 2030. Thank you. The meeting is adjourned.